Good afternoon, everyone. Am I audible?
Yes, ma'am.
Can you see the PPT?
Yes, ma'am.
Okay. Shall we start the class? Shall we start? Everyone has login. Let's start with the class. Today the class is on periodontal treatment in medically compromised and geriatric patients. So whatever the treatment we are giving to the patients, patients can be of different ages, different groups with different medical conditions. So based on their medical conditions and their age, we have to give the treatment to the patients. So the periodontal treatment, you will see the treatment in the medically compromised and geriatric, that is elderly patients. So many patients seeking dental care might have significant medical condition which will alter the course of their oral disease and therapy provided. So we know that systemic conditions are influencing the oral diseases and also the periodontal disease also they are affecting. So the therapeutic responsibility of the clinician includes identification of medical problems and consultation with or referral of the patient to appropriate physician may be indicated. So what is the responsibility of a dentist or a clinician is that first we are not only identifying the periodontal disease, we should also recognize the medical condition of the patient, and we have to refer the patients to the concerned physician, and based on that only we have to give the treatment for the patients with periodontal disease associated with any systemic conditions. So, what are the different types of systemic or medical conditions we'll come across are hemorrhagic disorders. So, patients with bleeding problems, renal diseases, liver diseases, pulmonary disease, infectious diseases, pregnancy condition, medications, and cancer therapies. So, these are the different types of medical conditions you will observe with the patients. So coming to the hemorrhagic disorders, so patients with a history of bleeding problems caused by the disease or drugs should be managed to minimize the risks of hemorrhage. So patients who is having a history of bleeding problems, so any previous history regarding patient has underwent any procedure and he has suffered with any post hemorrhagic situations, or he has identified with any hematological disorders, or because of some usage of some drugs also will lead to the disorders. So, by asking the proper history of the patient, we can identify the bleeding problems. And so, how we will identify is that based on the health history, clinical examination, so intraoral examination and everything, and if we suspect any disease, if we suspect that patient is having any bleeding disorders, then you have to refer the patients for the laboratory test. So complete blood picture. So whatever is required for the concerned hemorrhagic disorders, you have to test the patient before doing any procedure. Okay, so what are the different types of hemorrhagic disorders we can see are non-thrombocytopenic purpura, thrombocytopenic purpuras, disorders of coagulation. So thrombocytopenic purpuras are nothing but which are related to the platelet dysfunction. So thrombocytopenic can be related to platelets, decrease in the number of platelets. This is the condition with thrombocytic purpura. And non-thrombocytopenic purpura is this is regarding the not especially the platelet decrease, but it is related to vascular wall alteration and infections, any chemical allergies, and disorder of platelet function. Platelets are present, but their function is not proper. Any genetic defects, and not only this, patients with any uh, using any drugs like aspirin, NSAIDs, broad spectrum antibiotics, ampicillin, penicillin, gentamicin, vancomycin, they can also suffer with the non-thrombocytopenic purpura because these drugs will act on the platelet function, and also autoimmune diseases. This is the condition with non-thrombocytopenic purpura. After that, the disorders of coagulation. So there are some diseases related to the disorders of coagulation. During coagulation period, they will have some problem like inherited hemophilia A, Christmas disease, or von Willebrand's disease. So the von Willebrand factor deficiency will lead to the hemophilia A and or Christmas disease or von Willebrand's disease and acquired. So coagulation diseases are also acquired by liver diseases. So vitamin K deficiency, which are important in formation of coagulation factors, and anticoagulation drugs. Some drugs like prevent the coagulation cascade like heparin and formalin and anemic conditions. So the blood, this is the cascade of blood coagulation. So the deficiency or insufficiency of any factor in this cascade can lead to the lead to the disorders in coagulation. So after knowing the different types of diseases relating to bleeding, then we have to evaluate the bleeding disorders by taking history, physical examination, screening the clinical laboratory tests. So if the patient is already having the test, you should go through that, or if not, you have to prescribe the particular test regarding the disorders, and observation of excessive bleeding following a surgical procedures. So if you, after doing any surgical procedure, if you see excessive bleeding, then you can also uh, suspect any underlying bleeding disorder present in the patient. So in history, what you'll ask is bleeding problems in relatives. So family history of bleeding problems, if at all it is present, you have to ask, and bleeding problems following operations and tooth extraction. So previously, if the patient has undergone any operations or tooth extractions or trauma, and the history of bleeding post that condition, you have to ask. Use of drugs for prevention of coagulation or failure. So, what are the medical history? So, by medical history, you can know if they are using any anticoagulant drugs or any drugs which will interfere with the coagulation, you can identify. Spontaneous bleeding from nose or mouth. So this is the history you have to ask. Next, physical examination. So physical examination, you can see for the jaundice condition and petechiae purpura ecchymosis. So these are the bleeding below the skin region or mucosa uh, based on the diameter of the what is that, bleeding, you will name it as petechiae, purpura, and ecchymosis. Less than 0.2, it is petechiae, purpura is 0.2 to 1 centimeters, ecchymosis is greater than 1 centimeters. Any oral ulcers and hyperplasia of gingiva. So by observing physically these conditions, you can suspect any bleeding disorders. After that, you have to screen the patient by laboratory tests by PT, platelet count, bleeding time, prothrombin time, active partial thromboplastin time, and thrombin time. So these are the different uh, laboratory tests you should prescribe to the patient. So if the patient is history of bleeding problem is there, then you have to prescribe the patient PT, APTT, TT, and PT tests. If the patient is under aspirin therapy, BT, bleeding time, and activated plasma thromboplastin time, you have to advise. Formalin therapy. So, formalin therapy is antiplatelet drugs, anticoagulant drugs. So, then you have to prescribe PT, prothrombin time, renal dialysis. If the patient is under renal dialysis, patient will be under heparin drug. So then you have to prescribe APTT. Any liver diseases are there, BT and PT, chronic leukemia, bleeding time you have to advise. If the patient is under antibiotic therapy, long-term antibiotic therapy, PT you have to advise. Vascular wall alteration, then you have to advise bleeding time. If the patient is under cancer, then you have to advise thrombin time. So after identification, then what are the different types of, we will not advise the medication, but what are the common medication we will advise to the patients are coumarin therapy. So coumarin is a drug which is vitamin K antagonist. So inhibit vitamin K action. Sorry, these are the drugs which will prevent the coagulation, uh, like coumarin drugs. So vitamin K is essential for the formation of factor 2, 7, 9, and 10. So as this drug is antagonist to vitamin K, it will prevent the formation of this clotting factors. So duration and half-life is 40 hours for this drug. And if the patient is under this medication, you have to monitor the patient by knowing the prothrombin time. So international normalized ratio, INR ratio, should be for 1.5 to 2.5 for this patient. And alteration of coumarin dosage 2 to 3 days. This is about anticoagulant medication. If the patient is under heparin, so as I said, patient under renal dialysis, they will give heparin. So complex, they will inhibit the uh, 10, 9A, 10, 11, and 12A used in deep vein thrombosis and renal dialysis patients. The action of this drug is up to 4 to 6 hours given IV, and this can be monitored by using the test APTT. 50 to 65 seconds it should be present, and if you want to do any surgery, you have to discontinue this heparin for 6 hours before the surgery, and 6 to 12 hours post surgery. So and protamine sulfate can reverse the effect of heparin. So if you want to do any surgery for the patient on the heparin, so you have to stop the drug 6 hours before surgery, 6 to 12 hours post surgery with the consent with the physician. Next, aspirin. So aspirin is an antiplatelet drug. So most of the cardiac patients will be under this drug aspirin, and the action of it is it will inhibit the cyclooxygenase thromboxane A2 formation, and also it will affect on the platelet function. So the patients with this drug, we have to checked with the tests, bleeding time, and activated plasma thromboplastin time. And if tests are abnormal, physician should be consulted before dental surgery. So the patients with using this type of drug, you have to take the consent from the physician regarding stoppage of this drug or doing any procedure. So this can be stopped for 5 days, or you can substitute the alternative drug in consultations with the concerned physician. Next, thrombocytopenia is decrease in the number of circulation platelets. So examples are idiopathic thrombocytopenia, secondary thrombocytopenia. Um, they will give a drug for thrombocytopenia patients, tranexamic acid. Uh, if it is platelets is less than 20,000 per millimeter cube or excessive bleeding is present, then you will advise this drug, or you can give steroid or platelet transfusion also. Condition of thrombocytopenia. Next is von Willebrand disease with von Willebrand factor inherited. So most common inherited disease. So type 1, 2 and 3 is there. Here 70 to 80% and partial loss on quantity of this factor. And type 2 is poor on quality of this factor. Type 3 is severe loss on quantity of this von Willebrand factor will be present. The condition of von Willebrand disease. Next is hemophilia. Is a sex-linked recessive trait. Here there will be prolonged APTT, but there will be normal bleeding time and prothrombin time. Severity of the disorder is severe is less than 1%, moderate is 1 to 5%, mild is 6 to 30%. So treatment will be replacement factors. So we'll try to replace that by giving the replacement factors, antifibrinolytic agents and steroids. This is the hemophilia condition. If the patient with hemophilia comes to the clinic, then what are the things you can advise is preventive dentistry. So you can advise the patient for toothbrushing, flossing, rubber cup prophylaxis, and topical fluoride. You can give supragingival scaling without prior replacement therapy. So preventive dentistry you can do. If there is pain, then you can give block anesthesia, and you should not give any drugs like aspirin and NSAIDs. And you can do probing and supragingival scaling you can perform. In the cases of bleeding disorders, dental management is first, patient should undergo replacement therapy by platelet concentrates or thrombocytopenia patients. Fresh frozen plasma in conditions like liver disease, hemophilia A, and von Willebrand disease type 3. And factor 8, 9 concentrate you have to give in hemophilia A patients. In factor 9 concentrate in hemophilia B patients, and DDA-VP in hemophilia A, and von Willebrand type 1 and 2 patients. Next, antifibrinolytic therapy. E-aminocaproic acid you can give, tranexamic acid you can give. This is about the renal disorders and bleeding disorders. Are you able to follow?
Yes, ma'am.
Okay. Next is renal diseases. So patients with renal diseases, what are the different causes of renal failures are? Glomerulonephritis, kidney cystic disease, renovascular. So what are the different conditions or diseases related to the uh, kidney can cause renal failure? Drug nephropathy, obstructive uropathy, and hypertension. So result of renal failure is severe electrolyte imbalance in the body. Patients can See cardiac arrhythmias, pulmonary congestion, congestive heart failure, and prolonged bleeding. Patients with renal failure. So, in chronic renal failure or renal insufficiency, patients will suffer with headaches, decreased ability to concentrate urine, and polyuria and oliguria, and increased blood urea nitrogen levels and serum creatinine levels increased, and edema, and the glomerular filtration rate will progressively decrease from 90 to 30 ml per minute, and mild anemia will present increased blood pressure, weakness, and fatigue. So patients with renal diseases will have oral manifestations of halitosis, altered taste sensation, xerostomia will be there, gingivitis, enamel hyperplasia, and infections. So, treatment for the patients under with renal diseases. First, we have to consult the patient physicians regarding the condition of the patient, and we should monitor the blood pressure of the patient, and check the laboratory values: PTT, PT, bleeding time, platelet count, blood urine nitrogen levels, serum creatinine. You have to see, and drugs that are nephrotoxic. So there are some nephrotoxic drugs, so we should avoid those drugs in these patients, like tetracycline and aminoglycoside antibiotics. And patients who are receiving dialysis require modification in the treatment. So if the patient is having renal failure, the treatment will be the dialysis for those patients. So in those patients, the treatment will be different. So different modes of dialysis patient may be present: intermittent peritoneal dialysis, chronic ambulatory peritoneal dialysis, and hemodialysis. So recommendations for hemodialysis means, so if the patient is, if he wants to undergo hemodialysis, first they'll check for hepatitis B, C antigens before any treatment, and they'll give antibiotic prophylaxis. And if you want to give periodontal treatment, it should be provided on the day after the dialysis due to the effects of heparinization. So patient will be under heparin. So after the day of dialysis, you can give the periodontal treatment for the patients under dialysis. BP reading should be taken from the other arm, and this is about the renal patients. Next, patients under with liver diseases. So liver is a site of production for most of the clotting factors, right? So excessive bleeding during or after periodontal treatment may occur in patients with severe liver disease. So many drugs are metabolized in liver. So the liver disease alters the normal drug metabolism. So the causes of liver disease are drug toxicity, cirrhosis of the liver, viral infections like hepatitis B, C, neoplasms, and biliary tract disorders. So the primary causes of chronic liver disease is because of virus, alcohol, and hepatitis C virus, hepatitis B virus. So in combination with alcohol also can lead to the chronic liver disease. Next, coming to the oral manifestations of patients with liver disease are, they will present with candidiasis, angular cheilitis, atrophic glossitis, petechiae, and lichen planus. So coming to the treatment, first we have to consult the physician regarding the current stage of the disease, risk of bleeding, potential drugs to be prescribed during treatment, and required alterations to periodontal therapy. And you should also screen for hepatitis B and C for these patients. And laboratory tests, you should check for PT and PTT. So that is about the liver diseases. Next is pulmonary diseases. In pulmonary diseases, so from obstructive lung diseases like asthma, emphysema, bronchitis to restrictive ventilatory disorders that will interfere with effective ventilations, you have to identify. Acute respiratory distress may be caused by slight airway obstruction or depression of respiratory functions. So patients with respiratory distress they will have breathing problems. So we should be careful while doing procedures in these patients. And they will have oral manifestations of xerostomia, gingivitis, halitosis, and candidiasis. Treatment. So first we have to consult the physician regarding the condition. Any elicitation of respiratory depression or distress you have to avoid, and periodontal appointment should be minimized, and patient with emphysema should be treated in the afternoon. And also you should avoid the medication that can cause respiratory depressions like narcotics, sedatives, or general anesthesias you have to avoid. And also bilateral mandibular nerve blocks you have to avoid in this patient because they will cause airway obstruction, and the position of the patient to allow maximal ventilatory efficiency. So you should see that patients will have maximum ventilation. So in that position you have to place the patient and keep the patient's throat clear and avoid excessive periodontal packing. And equipments that produce aerosols. So ultrasonic scalings which will produce aerosols you should not use in these patients. And asthmatic patients, if there is present, you should have to ask the patients to come with their drug, the inhaler, while coming to the appointment. And if infectious patients should not be treated unless the periodontal procedure is emergency, like hepatitis B. That is about the pulmonary diseases. Next is the pregnancy condition. So pregnant patients can manifest with gingivitis, pregnancy tumor. These are the conditions, gingival enlargements, and also tooth mobility and tooth surface loss. So in these patients, minimize the potential inflammatory response related to pregnancy as well. There will be increased inflammation due to the alteration in the hormonal levels. So plaque control. So what are the therapies you can give is plaque control, scaling, replaning, polishing can be done. Best trimester which you can treat is second trimester, and patient should be in supine position. Sorry, not in a supine position. Supine position can cause obstruction of vena cava, and aorta leads to the supine hypotensive syndrome. So you should not be in a supine position, and patient should be treated in a sitting position. Patient should be placed on her left side by elevating the right hip during the treatment. So the compression of vena cava can lead to the supine hypotensive syndrome. So appointments for this patient should be short, and the patient should be allowed to change the position frequently. No medication should be prescribed ideally, and safer drugs you have to give. So only paracetamol for as analgesic. If you want to give antibiotic, you have to give amoxicillin. That's it. That is about the pregnancy patients. Next are the patients with infectious diseases. So like infectious diseases are hepatitis, HIV, and tuberculosis. So if the patient with hepatitis A, E, both are self-limiting infections with no associated chronic liver disease, and hepatitis B infection result in chronic liver disease in about 5 to 10% of infected individuals. D hepatitis D requires presence of HPV for its survival, and hepatitis C is the most serious of all viral hepatitis infection, and with high chronic infection rate. So patients guidelines for treating the hepatitis patients. If the disease is active, you should not give any periodontal treatment unless it is emergency, and you have to consult the physician regarding the hepatitis condition. If the patient is recovered, you can do routine periodontal care, and patients with anti-HBs positive and antigen negative may be treated routinely. What are the precautions you have to take is you should take the PT and breathing time, and complete uh, uh, protection should be taken. Usage of proper mask, gloves, eye shields, disposable gowns, and everything you have to take care. And after treatment, all disposable items should be disposed. So you should not keep the whatever the uh, what are the instruments or things which are used for the patient, we have to dispose it. So minimize the aerosol production by not using ultrasonic instrumentation. Air syringe or high speed hand pieces you should use. And before doing the procedure, we can pre-rinse them with oral cavity with chlorhexidine gluconate, and equipment which are used are scrubbed and sterilized. In HIV patients, so if the patient with HIV is you're treating, then you have to see the health status of the patient. You have to definitely uh, follow the infection control measures, and supportive periodontal therapy you should also render for those patients. The health status of the patient is determined by the history, health history, physical evaluation, consultation with the patient's physician, and treatment decision will vary depending on the patient's state of health. So CD4 lymphocyte level you have to check, and the current viral load and difference from previous counts, and current load of virus you have to see. Next, goals of therapy in these patients are restoration and maintenance of oral therapy. Control treatment should be directed toward control of HIV associated mucosal diseases such as chronic candidiasis and recurrent oral ulcerations. Effective oral hygiene maintenance you have to do. Conservative non-surgical periodontal therapy should be a treatment option for all HIV patients. So you should not do more extensive surgical procedures. Only conservative non-surgical therapies only you will give you will do the treatment for those patients. So the patients will have necrotizing ulcerative periodontitis and gingivitis, and based on the treatment protocol for those conditions, we have to give the treatment. Next, patient's periodontal therapy, supportive periodontal therapy for those patients. HIV patients, should encourage the patient to maintain the meticulous personal oral hygiene, and recall visits should be conducted at short intervals, 2 to 3 months, and systemic antibiotic therapy should be administered with caution, um, and blood investigations you have to do, and patient's overall health status consultation and coordination with the patient physician are necessary. So these are the different oral manifestations of patients with HIV, hairy leukoplakia, uh, and Epstein-Barr virus. Next, after HIV comes the tuberculosis in the infectious diseases. So patients with tuberculosis should receive only emergency care following the guidelines. Only emergency care because it is a infectious disease. The sputum culture for Mycobacterium tuberculosis should be done. If the results are negative, patients can be treated normally. So different symptoms of tuberculosis patients are coughing with blood, fever, fatigue, weight loss, chest pain, chills, night sweats, and feel hungerless. That is about tuberculosis. Next is cancer patients. So patients under anti-cancer drugs, so they will use bisphosphonates. Um, Potential risk factors which will contribute to the development are steroid therapy, alcohol, smoking, poor oral hygiene, chemotherapy, extractions, root canal treatment, um, periodontal infections, periodontal surgery, and implant surgery. So invasive treatment, any invasive treatments you should avoid in those patients, and caution and careful consideration of risks must be evaluated with the history of taking oral bisphosphonates for periods of longer than 3 hours. 3 years. Patients with bisphosphonate drug you should see carefully because the bone will be very uh, in a state of necrosis. So In the patients who are taking anti-cancer drugs, they will have adverse reactions for that. So, like bone marrow suppression will be there, nausea and vomiting, anorexia, GIT disturbances, alopecia. These are the adverse reactions with the anti-cancer drugs. So patients under radiation therapy, so patients with cancers who are under radiation therapy used to treat head and neck tumors. Complications for the patients under radiation therapy are mucositis, xerostomia, trismus, radiation caries, dysphagia, and osteoradionecrosis. So osteoradionecrosis is because of the treatment with the radiation, the bone is necrosed because of the bone marrow suppression. So patients who are undergoing radiation therapy, before radiation therapy, they should undergo the treatments like teeth that are restorable or severely periodontally diseased should be extracted at least 2 weeks before the radiation. And extraction should be performed in a manner that allows primary closure, and mucoperiosteal flap should be elevated, and teeth should be extracted in segments, and oleoplasty should be performed, allowing no bony spicules to remain. During radiation therapy, uh, under the period of radiation, patients should receive weekly prophylaxis, and oral hygiene instructions you should give, and professionally applied fluoride treatments you can give. And they are instructed to brush daily with 0.4% stannous fluoride or 1% sodium fluoride gel. After radiation therapy, if the patient is suffers with mucositis, you can give lidocaine, viscous lidocaine, salivary substitutes if there is xerostomia is present. If there is radiation caries, that can be prevented by topical fluoride application daily and maintenance of good oral hygiene. After 3 months, you have to recall the patient. And also, tooth extraction should be avoided after radiation therapy because it will involves high risk for developing of osteoradionecrosis. So, in conclusion, in managing the medically compromised patients, the clinician should always obtain a physician consult before any periodontal treatment. So, in all these medical conditions, you have to take the physician consent before doing any procedure. So, and also during change of any drugs for the patients, you have to take the consent. And you dentist should follow the recommendations from the patient physician and utilize the appropriate protocol. So the clinician need to cognizant of the systemic implications of periodontal disease and the treatment, and should stay up to date to give the best possible treatment. So that is about the periodontal treatment in the medically compromised and geriatric patients. Understood? Understood.
Yes, ma'am.
Okay, if the question comes or periodontal treatment in medically compromised patients, then you have to mention all these different types of conditions and the treatment you will give to those patients. And geriatric patients also, you can write these renal diseases, liver diseases, you can write in those patients. Sorry, patients with geriatric in the patients, elderly patients will have systemic conditions like liver diseases, renal diseases, pulmonary diseases. Those conditions you can include in those patients. Understood?
Yes, ma'am.
Okay. So we can take the attendance.
Yes, ma'am. Roll number 1,
Present.
2,
Present.
3,
Present.
4,
Present.
5,
Present.
6,
Present.
7,
Present.
8,
Present.
9,
Present.
10,
Present.
11,
Present.
12,
Present.
13,
Present.
See
14,
that you on your videos. Otherwise, you
Present.
will not get the attendance.
14,
Present.
15,
Present.
16,
Present.
17,
Present.
18,
Present.
19,
Present.
20,
Stay till the end
Present.
of the attendance because again she will read the absentees list.
20,
Okay, continue.
Present.
21,
Present.
22, 23,
Present.
24, 24, 25,
Present.
26,
Present.
27,
Present.
28,
Present.
29,
Present.
30,
Present.
31,
Present.
32, 33,
Present.
34,
Present.
35,
Present.
36,
Present.
37,
Present.
38,
Present.
39, 40, 41,
Present.
40, 42,
Present.
43,
Present.
44,
Present.
45,
Present.
46,
Present.
47,
Present.
48,
Present.
49,
Present.
50,
Present.
51,
Present.
52, 53,
Present.
54,
Present.
56,
Present.
57,
Present.
58, 58, 59,
Present.
60,
Present.
61,
Present.
62,
Present.
63,
Present.
64,
Present.
65,
Present.
66,
Present.
67,
Present.
68,
Present.
69,
Present.
70,
Present.
71,
Present. Present.
72,
Present.
73,
Present.
74,
Present. Present.
75, okay, 75, 76, 77, 77, 78,
Present.
79,
Present.
80,
Present.
81,
Present.
absent is 58, 77, 58 and 77, Ma'am, that's it, ma'am.
Okay, you can leave.
Thank you, ma'am.
Send the message, Zahra.
Yes, ma'am, I will.
Okay.